we can reveal the virus was already in the capital. Nike stores in the UK and around the world closed their doors for a deep clean. A number of Nike staff had tested positive, and they all had one thing in common. They had been at a conference here in Edinburgh at the Hilton Carlton around the 26th and 27th of February. Nike delegates had poured in from all over the world, but one of them had brought more than just a suitcase and infected a number of their Nike colleagues with Covid-19. We've discovered 25 confirmed Covid cases have since been linked to this one conference in Edinburgh. The public were not told the virus had been spreading in the capital in February or of the risk that posed. Nike told us all its employees have now recovered. The Scottish Government said those at increased risk were identified and their close contacts were traced, and public health authorities were satisfied there was no further infection risk. What would have happened if we'd locked down sooner? Professor Roland Kale leads a team of scientists who've tried to answer these questions.
So we have an existing model where we're trying to look at the spread of coronavirus, COVID-19, through the entire Scottish population.
First, they had to check their model simulations were in line with what actually happened in real life.
And so what you see over here is multiple simulation runs. The answer is variability, but there's a central tendency which matches the real epidemic.
And all these different lines shows that your model is there or thereabouts to the real figure.
Absolutely. So it shows us that we're sort of, it's the middle one. It's the most likely thing that we can find from our model. So once we have that understanding of what really happened, we can ask questions about what might have happened. So the particular question that we're addressing over here is a question of what would have happened if, rather than having lockdown on about the 23rd of March, we had done it about 2 weeks earlier. And while you see again that there's quite a bit of uncertainty in what the final outcome will be, all those lines are now substantially below what actually happened.
Based on figures from last week, the model predicts fewer than 600 deaths in Scotland. That is an exceptionally dramatic difference in numbers from 2,795 down to 577. That's huge.
If you start your controls earlier, when you have fewer deaths already, it means that it'll start to decline from a lower place, and the end result is a smaller epidemic.